Hi everyone, it's Ryan Liberty, and in this video we're going to talk about how to help someone who's been through trauma. We got this.
Ooh, ah.
Okay, so let's get into how to help someone who's been through trauma. So before I get into that, the one little thing I need to say is that I am not a licensed professional, so take this information for what it's worth. I am somebody who's experienced trauma, and I have experience helping people with trauma in my support group, and actually that's where this question came from. So, I'm in this field. I know generally how trauma works and how to help people through it, and with that said, this is what I came up with, and I wrote down, because I wanted to make sure I communicated this very clearly with you, how I feel that somebody should help somebody else who's been through trauma. So I made a note here that there are different periods to be aware of when you're helping somebody with trauma. So you've got like the calm in-between periods where nothing's really going on. You've got when trauma is actually being experienced or somebody's having a flashback. And then you also have the period immediately after the trauma. So I'm going to go through each period and let you know how I feel that you should be handling those situations. So during those calm in-between periods where not really much is going on, these are the steps that I feel that you should take. For one thing, you want to know what your limitations are when it comes to helping somebody with trauma. So first, know that you may not have the training to be able to help somebody with trauma. Somebody that's a licensed therapist, for example, who does not specialize in trauma will often refer out to somebody who does specialize in trauma, because it's a different way of working with a client when they have gone through a traumatic experience than with a different type of client. And people who are licensed, who practice, know this, and they refer out because they know their own limitation. And something else to be aware of is that you cannot do this work for that person. You can't force somebody to move ahead with their healing. You can't make it happen faster. You just got to know that person has to work on it at their own pace. It can take years for some people to work through trauma, so be aware of that. Also, be aware of secondary traumatization. When you work with somebody or when you try to help somebody who's been through trauma, them discussing their own trauma can be very traumatizing for you. It may bring up stuff in yourself that you may not even realize was buried in there. And very often, people who do work with clients who have been traumatized, they will only take on a limited caseload of clients who've been through trauma for this reason. Because when you work day in, day out with people who have gone through trauma, it can really drudge up these negative emotions in you. It can make it very difficult for you to cope with your own life. You could wind up with things like nightmares, and if you want to learn more about this, you can watch my video on secondary traumatization. But just be aware that it can be a lot. It can be a lot for one person who's even trained to handle somebody with trauma to deal with. So be aware that it may be a lot for you, and it may bring up stuff. And of course, because of that, you want to make sure that even though you're helping this person, you have a self-care routine going for you, that you're taking care of yourself, you're making sure that you're coping and kind of de-stressing after you talk with this person, so that you're able to manage your own emotions and manage your own reactions to everything. And then the other part during these calm periods that you want to be careful of is to know their limitations. So listen to them, I would say, is the biggest key here. Listen to what they're telling you. If something seems like it's too much, maybe they may not even tell you. Be aware of that as well. If it seems like somebody's getting agitated, they're getting a little too stressed out, be aware of that. And know when, start to learn what is it that makes them get in that place so that you don't push them too hard. You never want to push somebody who's been through trauma too fast, too quickly into something, because you will push them much further back in recovery. So if anything, you want to go very slowly and know their limitations. So that would be things to do during the calm periods. And there's more that you can do that I'm going to get to in the after trauma period, but that's my little summary of what to do during the calm periods. Now, during trauma, or when somebody's maybe re-experiencing trauma, something like a flashback, these are the things that I recommend. So the first thing, if necessary, call for help. Again, this goes along with knowing your limitations. If something's going on like a panic attack, you may not know how to handle that. So make sure that the proper people are contacted. If emergency services need to be contacted, whatever the situation is, maybe just calling a friend or somebody who knows them better, make that call for yourself, but don't try to handle something that is beyond the scope of what you can handle. Also, accept that during trauma or during them re-experiencing trauma, they are going to be uncomfortable. They are going to be stressed. They may be angry. They're going to be irritated. Accept that. Just allow that to be. Don't try to change it. Don't try to change the way they're feeling. Just accept that they are feeling that way. The next thing, especially when they're experiencing trauma, try to get them to be grounded. So grounding is simply bringing somebody back into their environment through the 5 senses. So get them to look around at things in the room. Sometimes it helps to actually reorient and get them moving their head and their eyeballs. Get them touching things, experiencing the texture of maybe like a fuzzy blanket, or maybe something a little spiky, prickly, anything to kind of get them in touch with their bodies, especially the legs, because we typically ignore the legs when we kind of curl into our bodies. So get them in touch with their feet, with their legs, with the grounding, get them in touch with their environment. Maybe give them something to smell, something to taste, anything to bring them back to where they are. And again, within limitation, if they're in an unsafe environment, of course, you want to call the proper emergency services or whoever can help you get out of an unsafe environment. But we're assuming that this is something like a flashback, that where they are safe. Just get them to the point where they can be here, be present, and acknowledge what's going on in a safe way. So going along with that, remind them that they're safe and remind them that you are here with them, and get them to experience feeling safe. And this may go along with knowing what their limitations are and knowing how they experience trauma. Maybe there is an object or something that will remind them that they are safe, or maybe a phrase or something that you can help remind them of in this moment to bring them back to where they are and to make them feel safe. So also, guide them towards the resources that will help them to cope. So maybe they have a journal, maybe a therapist has laid forward a program or something that they can use. Get those resources available for them. Maybe there's somebody that they can call that they feel safe with. Again, encourage them to go towards those resources. And very important during this all is to monitor your own emotional state. And make sure that you are calm, that your breathing is okay, that you're not frazzled and excited and rattled by everything. Because if you become emotional and rattled and a little bit frazzled up by everything, you're going to magnify that in them. And they are already unable to cope with it, so you're just making it a lot worse if you don't notice it within yourself and you don't keep it in control with yourself. And this is again why I say very often it's a professional who should be doing this, because the professionals have been trained to monitor their own emotional state and make sure that doesn't get in the way of helping somebody with trauma. Now, for after trauma, again, I'm going to just say a big key here is to listen. And I put so many stars around this because this is like one of the most important things when it comes to somebody who's experienced trauma. You must validate their experience, validate their feelings. It doesn't matter if you think the way that they're thinking or that they're feeling is wrong. You must validate how they are feeling. If they are scared, it doesn't matter if you feel like there's no reason for them to be scared. Tell them, I understand that you're scared. I can see why you would be scared. I don't maybe know what's going on that's making you scared, but I see that you're scared. It's okay to be scared. Validate those feelings. Those feelings, when they are invalidated, it sets off a whole host of problems, and you can watch my video on what invalidation is to learn more about those problems. But please I also have a video on how to validate, what validation is. Check that out. So validate their experience, encourage them to get in touch with how they're feeling emotionally and how it feels in their body. You know, do they have pain in somewhere in their body? Is their posture maybe not correct? Get them to sit up straight. How is their breathing feeling? Are they sad right now? Are they angry? Are they feeling good? Get them in touch with all those things so they can re-experience what their body feels like, and they can start to put labels on what's actually going on. Encourage them not to isolate themselves. When somebody goes through trauma, it's natural. It's just a natural reaction to want to get away from people, not trust people, see people as scary. So if you can gently, of course, don't push anybody, but gently encourage them to stay in touch with you, let them know that you're there to listen, guide them towards a therapist, get them in maybe a support group, whatever they feel comfortable with. Don't push them into what you think is right for them. Get them get them around people that they feel comfortable with. Also encourage approach coping when appropriate. So you have avoidance coping and approach coping. Again, I've got videos on both of those, but when it's appropriate, encourage them to go towards the trauma, which is totally the opposite of what they want to do, because that is the terrifying thing that they have experienced. But when they are in a safe place and it's more of a calm period, if you can encourage them to just think about what happened a little bit, again, while monitoring their own feelings, monitoring their own body to see what comes up. In low doses, very small increments, get them to think about it, talk about it. That will help them to begin to heal. And again, just to reiterate, you want to monitor your own emotional state through all of this to make sure that you're not getting worked up and then working them up in turn. So that has been a mouthful on how to help somebody who's been through trauma, but I hope it's helped you. And if you have experienced trauma, or maybe you're somebody who has helped somebody who's gone through trauma, I'd love to hear any of your tips, so please leave them down below. And thank you for wanting to get to know about this and helping your friends and family and loved ones today. Do you give a about mental health? If you do, I've got some coloring pages for you I think you'll enjoy. Go ahead and click to get those. If you like this video, I have many more on YouTube, so I'd love it if you'd subscribe. And if you have any comments or questions, go ahead and leave those below for our community and share with a friend. As always, I'd like to remind you that your life matters. Nobody can question your worth. However it is that you're feeling, whatever it is that you're going through, it's okay, and you are loved. Thanks again for watching.